Live at 5 News Hour, we told you about a form of gum disease and an innovative way of treating it.
That's right. So News Channel 2's Brent Carney now introduces us to two of the many patients who've had success with this procedure.
You could just tell that something good was happening in your mouth. And since then, my gums have been much, much better.
Brian Molinaro was one of many of Dr. Melnick's patients that had previous problems with his teeth. For him, the Lannett procedure was his best option.
When you hear the options described and you think it over, there's really no choice. To me, it was like there was no way I would have not done the Lannett procedure after I heard how good it was and what it would do for my situation with my gums.
Traditionally, gum disease was treated with this, a scalpel. Now it's being treated with this, a laser.
Experts tell us that the traditional surgery could be painful.
The old way of treating it oftentimes required surgical treatments, scalpels, stitching, which was uncomfortable, was painful, and took quite a while to recover from.
Pat Mungary also had problems with gum disease in the past.
My gums bled very easily. I could bite into an apple and there'd be blood on the apple. So I knew something wasn't right, and I had to do something.
Lannett treats a form of gum disease that damages tissues in your gums, causing the bones supporting your teeth to decay. Dr. Melnick says that the disease may be hard to detect, but there are warning signs.
Periodontitis, unfortunately, is painless. And so most people, why do we have such high levels, such a prevalence of this disease in this country, is that it doesn't hurt. And we have this thought that if there's no pain in my mouth, everything's okay. And the mouth doesn't work that way. But anytime you see bleeding after brushing or flossing, that would be a sign that you need some attention.
Brent Carney, News Channel 2.